Hello, everybody, and thank you for joining us. I am Sean Fisher. I'm the Executive Director of the Agnesian Healthcare Foundation here at SSM Health. I'd like to take you back to 1998. Dale Michels was a resident of our neighboring community of Brownsville and owner of Michels Corporation. He entered our emergency room here at St. Agnes Hospital, where he was assessed to be having a heart attack. At that time, St. Agnes was not able to provide the critical heart care that Dale needed. Winter weather conditions were cold and fierce, which complicated transportation to a different hospital, and Dale passed days later. In 2006, the Michels family made a decision that would have a significant and long-lasting impact on the Fond du Lac community. Recognizing this critical care for heart care, they turned their tragedy into an opportunity to prevent the situation from happening to others. At that time, the Michels family donated $1.5 million to help launch the Dale Michels Center for Heart Care, now Dale Michels Heart and Vascular Care. This contribution would change the course of heart care in our community, providing much-needed critical care and saving countless lives. Since its opening in 2006, SSM Health Dale Michels Heart and Vascular Care has grown immensely, becoming a destination for cardiovascular excellence, now performing both vascular and structural heart care. It's become the fastest growing and third largest Watchman program in the state, performing more than 500 electrophysiology procedures per year, and now performs all structural heart procedures aside from heart transplant. While the rapid growth and advancements of our cardiovascular program would be an outstanding accomplishment for any community of any size, it's particularly impressive in a smaller community like Fond du Lac. According to the American Heart Association, cardiovascular disease is the leading cause of death among both men and women in the United States. Here in Wisconsin, 1 in 3 deaths is caused by heart attack or stroke. When a cardiac emergency occurs, time is of the essence. Having quality care close to home is critically important for providing immediate and life-saving intervention. However, the demand for quality heart care in Fond du Lac has outgrown our original resources. We've added many expert providers, we've added innovative and advanced technologies, and now we will be adding much-needed space. I'm happy to share that the Michels family has committed $3 million to support the expansion of the SSM Health Dale Michels Heart and Vascular Care. This $8.5 million project will be a year in the making. When it's complete next year, it will feature the addition of a cardiac electrophysiology lab, additional prep and recovery rooms, private consultation rooms, and the addition of new semi-private family waiting spaces. This project will have an immediate impact on heart care in our community, reducing wait times for heart procedures, maintaining a local continuum of care where patients can receive comprehensive heart care in one location, and will support long-term heart care advancement. The Michels family generous philanthropic gift will not only support this vital expansion, but through their established endowment will support heart care advancement in the Fond du Lac community for years to come. I'd like to now ask Pat Michels to come up and say a few words.
Thanks, Sean. Yes, we are very proud of being able to do this and continue the support of the Dale Michels Heart Center. I would like to say that, back in 2006 and prior to that, Bob Foley and I had Bob was the president of Agnesian Healthcare at the time. We had a lot of conversations of heart care in Fond du Lac and what we needed to do. And as Sean said, when our father had his heart attack and came here and they could not service him here, that they needed to go to a different hospital. And that time in between from when, we had to get him sent from Fond du Lac down to the Milwaukee area, what did that do? What did he lose in that time? And then on top of it, a little additional note to that was that evening, it was probably one of the coldest nights in March, and Flight for Life helicopter was going to take him down there. They shut the engines off, got him all loaded up, fired up one engine. There's 2 engines, I guess, on that helicopter. The second one wouldn't start. There he sat while they were trying to figure out how to get that going. All that lost time. Finally got figured out, not going by helicopter, find a transport. Try to find a transport at, I think it was by then almost midnight. Again, time lost. Got him to the hospital. They scheduled him for surgery, and he had a complication. The surgery, heart surgery, was successful, but he had a stroke also, and that did not fare well for him. So we, again, if we would have had the Dale Michels Heart Center at that time, he'd probably still be here, because I think time is of the essence. And so when St. Agnes had put this Dale Michels Heart Center together, put it up and running, we were very proud when they said they would name it after my father, our father. So it kind of fast forwards to, today. One of the things that we do as a family that the hospital does, they have I think it's in February, a heart celebration for the heart care patients. And one of the family members comes every year and talks at that. Hopefully when we get past COVID, we can continue that again. Because it was a great thing, because we were able to see people that we know in the community come up to us and thank us for this opportunity to have the service here in Fond du Lac, that they didn't have to go to Milwaukee or Madison or up into the valley. They could have their health care, or heart care, done right here. I think that's really important. And we're very proud of that. And people come up to me, I know my brothers, in the street and say, "Oh, thank you. I was just at the heart care center. It was, I had a great experience there." Or one of their loved ones, a sibling or a spouse or a grandparent. It's just something that we're very proud of to be able to support, because this is what we want to do. This is what our father envisioned and our mother. And unfortunately, last year, in 2020, we lost our mother and to other health issues. But anyway, she was very proud of the Heart Center here also and being part of that. So we were happy when Sean called and said that she had a proposal for us for the upgrade. We knew that the Heart Care Center was looking to expand. I know that there's waiting lists for a lot of the services here, and this will hopefully alleviate that. Healthcare isn't going away. Heart issues are not going away, and I think we're very proud as a family to be part of this and to be able to do this for the community. So I don't know, my brother Tim or Kevin, do you want to come up and say a few words? Okay. I don't know if we want to let Tim have the mic, but.
Thanks, Pat. This is really important to the community, and as many in this room know, I'm a customer of the Dale Michels Heart Center here. I'm living proof that great quality cardiovascular care right here in Fond du Lac pays off. Quick story, I had the old shortness of breath. I'm a guy, nothing's wrong with me. Woke up one day and said, I better call the doctor. And 2 days later, I was on the treadmill, and I wasn't even back to the office yet in Brownsville, and they were trying to get a hold of me and said, you get back up here. And a day later, I received a couple stints. I asked the doctor, I said, what would have happened if I wouldn't have, I said, you probably wouldn't have made it real long, Kevin. It's a good thing. And right here in Fond du Lac, I was able to take care of that problem. And as Pat mentioned, how many other people have enjoyed maybe a longer life? Their spouse or family member, colleague has enjoyed a longer life because they could come right here in Fond du Lac. I'm sure a lot of people like, oh, I'm not driving to Milwaukee, or I'm not going up to Appleton, or wherever else, I don't know, Madison, wherever else you may have to go to get your heart care. And I'm sure because it is right here in Fond du Lac that a lot of people are around today. So it's really special to the family. Pat brought this to the family here a while ago and said, this is an opportunity that we have. It was a pretty easy decision, especially on my part, but I think for the entire family here, we're very passionate about this, and it's just a great thing for the community, and we are very thankful that we could be participating in this also. So again, thank you to SSM and the leadership here to allow us to be participating in this great thing for the community. Thank you.
I was actually looking forward to a little break today from giving some speeches, but Kevin, you should run for something. That was awesome. Pat, excellent. Just real quick, this just warms our heart, and we get requests. We've been very blessed at Michels, incredibly successful, and we get requests from all over the country and all over the state. And we have a philosophy in the Michels family that there's so much that needs to happen right here in Fond du Lac, in Dodge County, and it's so important to help philanthropically right here, where it makes a huge difference to friends and neighbors and families and people that work for us and their family as well. As Kevin just said, Pat said, people come up to us on the street and like, the Heart Center, the Dale Michels Heart Center, it saved my father's life. And that just warms our heart. And we love the work that you're doing here. We're proud to continue to support what you're doing here, because this is home for us. Our grandfather, he was born and raised just a little bit east of here in the Holy Land. Dad was born and raised in Brownsville, Mom born and raised in Camelsport, and of course we were all raised in Brownsville. And there's nothing better to give back right here at home to friends and family. Thanks for all your hard work. You're saving lives, you're making a great difference. Our partnership is so powerful, and we look forward to continuing that. Thank you.
Hi, I'm Tadeo Diaz-Balderrama. I'm one of the cardiologists here that had the pleasure of joining the group in 2018, and I was tasked with talking about our growth over really since 2006. First and foremost, as a department, we really want to thank the Michels family. Really, without your support, our community would not have the cardiac care that they're able to rely on today. And the generous gift just continues that tradition of commitment to the community in Fond du Lac and the neighboring communities. Really, when looking back, it's incredible to see what we've been able to achieve. Since the cath lab opened in 2006, we performed 14,654 heart catheterizations. We started at about 1,400 in 2006, and we steadily climbed almost to 2,900 last year. We have added electrophysiology services, performing 538 ablations since 2018. Our imaging services have expanded to include cardiac MRI, coronary CT, 3D echocardiography. We have implanted 93 cardiomems in patients with heart failure to help decrease the chances of being hospitalized. We have started a structural program in June 2019, and we've seen a lot of growth in that area, implanting 118 transcatheter aortic valves. So this is giving options to patients who are at less invasive options to patients who need valve replacement. We've even done valve in valve, valve in other valves as well, so it's really become a great program. We just recently launched the MitraClip program as well, further expanding our options. We have options for patients who are on blood thinners and have an increased bleeding risk. We've become one of the fastest growing programs in the state, implanting 123 devices since we started and seeing a 70% growth since 2019. We have really our cardiac and vascular surgical support has grown to include continuous coverage and access to emergency procedures, really emergency life-saving procedures. We have been able to provide expanding consultative services for patients with heart failure, complex coronary artery disease, cardiomyopathies, and arrhythmias. And when the need arises, we've been able to develop relationships with those with those areas that are much, much more specialized to bring those services to the community, or at least have a direct line of communication. Areas like pediatric cardiology, adult congenital cardiology, advanced heart failure, and pulmonary hypertension. This is a huge, huge endeavor, and all this has been because of the generosity and support of the Michels family. From the start of the program to opening of the hybrid lab to countless other areas where we've looked for support, really the community is blessed to have the Michels family to help with this growth, and we probably wouldn't be where we are at today without your support. I do want to be clear, it is very unusual for a city this size to have a program with this many offerings. You just have to look to the neighboring communities to see that. Really, our ability to continue to grow and to bring these services locally has been because of the very generous support. And I know we can get lost in numbers, but I think as many people mentioned, each one of these numbers is a neighbor, a brother, a parent, a sister, a son, somebody who didn't have to travel to receive quality care, somebody who had the opportunity to enjoy a better outcome by receiving care locally and immediately. So thank you very much again from everybody.
Thank you, Dr. Balderrama. You say electrophysiology much smoother than I do, so thank you. Again, thank you, Pat and Tim and Kevin, for saying a few words. Thank you for joining us. Thank you for your support. St. Agnes Hospital has been a pillar in the community for more than 125 years now. SSM Health and the Agnesian Healthcare Foundation has and will continue to invest in our community and our commitment to exceptional healthcare. We're truly grateful for the Michels Trust, their unwavering support, and their true partnership to continue to advance quality healthcare in the Fond du Lac community. So thank you.